Today we're going to talk about how we approach spine pain and identify structures that potentially are what we call pain generators, so we can direct our treatment appropriately. So this is a model of the spine, and this would be the front, and this is the back. And we have the vertebra, that's the main bone structure of the spine. And between the vertebra is a disc, and the disc has a soft center called the nucleus. If we look at it end on, about 2/3 of the middle is a gel-like material, then around it's the annulus, is a denser material that contains that soft material. The disc can bulge out of place, and that's kind of like a tire that's low on air. A big bulge would be called a protrusion, and then you can have a disc herniation. A disc herniation is sort of like a bubble in a tire where the gel comes out. Anytime the disc comes out of place, it could impact the nerve. Behind the vertebral body and the disc is the nerve canal. It's called the epidural space. And the epidural space houses the nerves, and at each level, a nerve comes out and supplies a different part of your leg. So there's 5 vertebrae in the lumbar spine. We call them 1 through 5. And when we talk about levels, we're describing the level based on the vertebra they sit between. So for example, this level would be the L4-5 disc. And behind the epidural space and the nerve canal is the facet joint. The facet joint is a little knuckle-sized joint that sits between the vertebra. When we bend, that joint moves. And then below the lumbar spine is the sacral spine. The sacrum is actually 5 vertebrae fused together. And there's a joint called the SI joint, sacroiliac joint, which is right here. So again, when we think of potential structures that cause pain in the spine, we have the vertebral body itself, and there are certain findings on an MRI scan that we look for to determine whether that is a potential source of pain. We have the disc, and again, a disc can bulge out of place, protrude out of place. These can cause pressure on the nerves. This can cause pain down the leg. Each nerve supplies a different part of the leg. So for example, the L5 nerve, which is coming out right here, will supply the outside of your leg. So if you have pain in the L5 nerve distribution, it'll be down the side of your leg and side of your calf. The S1 nerve, which is the first sacral nerve, will go down the back of your leg and so forth. So we can track what level may be involved based on whether there's leg symptoms there and where those leg symptoms travel. So we can have the vertebral pain we talked about, the disc pain, nerve pain, we also talked about that. And then the joint itself can be symptomatic, that's the facet joint. The facet joint can become arthritic, and like any arthritic joint in the body, that can cause symptoms when you're using that joint. And likewise with the SI joint, that can be a symptomatic joint. So how we determine where the pain may be coming from is based on the history. So there's certain features we look for. For example, sitting puts more pressure on a disc. So if someone says they have trouble sitting for any period of time, that may suggest more disc pain or more vertebral body pain. When we stand, we have a little curvature arch in our back, and we load those joints. So a patient has more trouble standing, may suggest that it's a facet joint problem. And if the pain's gone down the leg, then we suspect there's something wrong with the nerve. The nerve can be impacted by the disc, again being out of place, or bone spurs that develop, which is again a more degenerative kind of change. Bone spurs, the body's way of trying to stabilize deterioration, degeneration. And so you can develop a bone spur around the disc, or the facet joint itself. When it becomes arthritic, it's like a knuckle joint that becomes arthritic, and you've probably seen people with knuckles that get enlarged from arthritic change, and that happens with this joint, the facet joint, as well. But when that happens, the joint enlarges and it starts to take up room for the nerve, and that causes a narrowing of the spinal canal. The other name for that is stenosis. So stenosis can cause a pinching, if you will, of the nerve, particularly when we stand up. Again, we're looking at the history. and these symptoms are typically worse when we're standing or walking. So we look at the history, we look at the findings on an MRI scan. Are we seeing a disc protrusion? Are we seeing arthritis in the facet joint? And then ultimately we may use injections to establish that diagnosis. So if we think it's a nerve, we may put medication around the nerve root, call that a nerve block. We can look at the facet joint by blocking the facet joint, and then our treatment would go from there in terms of steroid injections or other procedures we have to try and address these specific diagnoses.